I don't like being called a hero. I don't think that's a word for me. I think that working throughout this time has taught me that just like me, there's thousands and thousands of doctors out there that do have the compassionate heart. They do have the realistic ways of healing, which is through education, through serving, and through being. So I grew up in Puerto Rico, but I was born in Dominican Republic, in Santiago, Dominican Republic. And at 2 months old, my mom took me with my father to Puerto Rico, where I was raised until the age of 11 years old. And then I transitioned because they decided to retire to the island when I was 11. So we went to Dominican Republic back. During that time, I learned about how a human can adapt. We left Puerto Rico and went to Dominican Republic at times of turmoil. The gas was extremely expensive. We had power outage. At that time, we had the sugarcane shortage. Adapting for those changes was difficult for an 11 years old, but it taught me resilience. I always dreamt of coming here and doing my residency here. At the age of 23, when I did not expect it, many things happened. One of them was that my father was diagnosed with an adenocarcinoma of the biliary tree at the level of the liver at the age of 51. And he saw me graduating. That for me was extremely important because my father was extremely proud of me. Through the course of his disease, it was approximately 7 months, he taught me the changes of transformation of a human being whenever they have faith. In 2009, I decided I am going back to New York City and I wanted to work in Washington Heights, where the Latino communities are, where the Hispanics, independently of status, of color, we all live together here, and this is where I wanted to be. Before the pandemic, I used to be, and I am still, the medical director of YPP New Modern Medicine, which is an internal medicine practice in the Washington Heights area of New York, an underserved community. When the pandemic hit, I couldn't just sit and stay still in my office or at home. So when SOMOS called the physicians for help, I joined because our communities needed us. We started by keeping the New York Stock Exchange open until they figure out a plan until they went electronic. After that, I was assigned as the site lead or testing site coordinator of Lehman College in the Bronx, the first testing site in a zone where there was a positivity rate between 40 to 50%. At a time that we didn't know anything about the virus, and the virus was killing our people. There we stayed until approximately 2 to 3 months, and we used to see between 400 to 700 to 1,000 patients a day. After that, other projects continued to open up and they required our help. Did what we call the reopening of the clinics, a safe reopening, and we tested all the physicians, all the staff members, so they could go back into the community and be safe. Eventually, we decided to help within the communities, and they assigned us, specifically me and a team, to go to the Lower East Side. After these numbers came down, a governor's office called SOMOS, so we could help them out, what we called paying it forward. And we went to help the states that were at the highest numbers and they needed our help. We went to Houston, Texas, where we spent 2 weeks, and we helped the African American community in the Fallbrook Church, also the Latino community, and we established the first site in Texas that was walk-in for screening. After those 2 weeks, we went to Tampa, St. Petersburg, and there we saw a different population. We saw elders. We saw the elderly population that were so afraid to come out. December, I had the opportunity at the end to see my family after almost a year. January 6th, we were able to see the light at the end of the tunnel, and that's when SOMOS called us to start the project, the Vaccine of Hope. And on January 6th, we started once again vaccinating the physicians of the community, the staff in the community, so they could go back and even feel safer. The vaccination process came, the hope came. Where are our vaccines? The people, our people needed vaccines. We were testing, we were screening. So there, the community physicians that are not affiliated to the hospitals were important. But now in the vaccination process, where was our vaccines? We didn't have the capability to have this vaccine of hope in our hands for our people. If I was not going to be able to vaccinate my patients, my community, my people in my practice, what did I have to do? Go out there in the community and help in all these mass vaccination centers. So SOMOS assigned me as the medical director of the Aqueduct, which is a mass vaccination center where up to date we've vaccinated 90,000 patients. Then we have other projects that are called the pop-up sites. And the pop-up sites are where we go into the community, into the buildings, into the churches. So there's something called NYCHA here in New York City, and these are buildings that are projects for people with low income. And we go into these places 1 or 2 days, we vaccinate the community, and then we go back 21 days later. So for me personally, the most difficult part of this pandemic was watching the death of patients that were extremely dear to me. Patients that were in my practice for more than 10 years, that they became basically my family member. I had this patient. She was very special to me. And she used to be the midwife of a city in Dominican Republic called San Francisco de Macorís. And every time she used to come to the waiting area, she will say hello to everybody. She was a woman of church, she had 6 children, everyone loved her. She gave so much life to so many people. And you know how she died? She died alone, in a cold bed, in a hospital, with no one to hold her hand. So for me, that was very difficult to forget. I won't forget. And just like her, so many. I had patients calling me, "Doc, my mom is having an anxiety attack." And when I saw them, it wasn't an anxiety attack. They were hypoxic. They couldn't breathe. So you had to educate them and tell them, take her to the hospital. And with that same education, which we spent all throughout the pandemic because we never stopped, we tried to tell them, quarantine, isolate, but where do they do it? They didn't have a space to do it. 10 people live in one room. This is the way we live in New York City because of the economic resources that we have. So that was hard, very hard to see and to feel and to embrace during that time. I have seen it all. We've been at it since day number 1. And I have seen so many injustices that it just got me to the point that I had to open my mouth and speak and bring justice into the injustices that I saw. When did you ever had a coronavirus pandemic before that your policies and your guidelines have been written? Oh, we have policies for Ebola. This is not Ebola. This is something else. Seeing that, feeling that, looking at the injustices of the community, on seeing how our people had to go out every single day, no matter what, because if they didn't go to their works, they were going to get laid off. And then they were not going to have money for their family members. If you have a voice, you speak for them. You have to fight and you have to help those that are not as privileged as we are. SOMOS, I believe that it's the best network of physicians that is out there, of providers that is out there. We shouldn't be only in New York. We should be in the whole United States. So many of our doctors perish in this pandemic because they didn't stop taking care of their patients. Of course, we could die. We knew the risk, but we had to do it. He gives me the strength to go on. While I was in med school studying science, I became an atheist until my father died. That's when I converted again into my faith, and it became really strong because then I believed that God exists, that Jesus is there with you and I, that it doesn't matter what happens. Whenever I had a problem, I always asked God first to show me the way to lead in my life, and He will show it. He will never, never disappoint. Even if it was something that I didn't want, God will be present, showing me what He wanted for me. So during the pandemic, now we're in present time, we couldn't go to church because all the churches were closed, but SOMOS started what we call the nightly prayer at 8 p.m. every night since the beginning of the pandemic, with Mario Paredes, Dr. Talash, and Lydia Virgil, where we called each other and pray to Jesus, Mary, and we bring all these prayers and devotional for 30 minutes. And that we have been doing until today, every single day. And whenever I felt that I was not protected, that I was gonna get sick, that my faith was being weaker, that group, that prayer brought joy and hope into my soul. So yes, extremely proud of being part of SOMOS.